Now we are going to start about the important cytokines. In important cytokines, basically we are going to study about interleukins. First, let's segregate the interleukin word. The inter means between and leukin white blood cell. It means between white blood cells. Basically, the interleukins are way of communication of a messenger between the white blood cells after producing from the macrophages in EKC. The interleukin 1 is causing the fever. Before going to elaborate, we have a small mnemonic that is hot T-bone streak. Hot T-bone streak. And you have to give the numbers in sequence with the interleukin 1, 2, 3, 4, 5, 6. The 1 hot fever, the 2 is T means stimulate the T cells. The 3 is going to stimulate bone marrow, hot T-bone, and streak. ST is nothing. E stands for IgE production and 5 for IgA production, and K is stimulation of acute phase protein production. That is a wonderful important mnemonic you have to memorize. And second, elaborate the type. First, the interleukin 1, you already know what is causes a fever and acute inflammation. It activates the endothelium to express the adhesion molecules, induce a chemokine secretion to recruit the WBCs, and also called osteoclast activating factor. The interleukin 1 is acute phase. Interleukin acute cytokine, and it causes basically fever. They activate the endothelium for the adhesion molecule, induce the cytokine secretion for WBCs, and secondly also called osteoclast activating factor. Now come for the interleukin 6. The interleukin 6 also causes fever, but stimulate the production of acute phase protein. This is the most important function of interleukin 6 for the production of acute phase proteins. Second, we are having tumor necrosis factor alpha. The tumor necrosis factor alpha is going to activate the endothelium and causes WBC recruitment and vascular leak. And it causes cachexia in the malignancy, maintenance of the granuloma in TB. And also interleukin 1, interleukin 6, and 2 can mediate fever and sepsis. So mean is that if you guys going to an infection, and after infection they will be going for sepsis, the main role in sepsis is going to play by tumor necrosis factor alpha. It's also very important point. Interleukin 1, 6, and tumor necrosis factor alpha can mediate fever and sepsis. And you know, and non sepsis mean bacteria coat in blood. And secondly, there is a maintenance of the granuloma in the TB is also done by tumor necrosis factor alpha. The question for you, what important point? Interleukin 8 is a major chemotaxis factor for neutrophils. You can remember they clean up on S8. Neutrophils are regulated by interleukin 8 to clear the infections. The interleukin 8 are going to clean the infection by neutrophils. Neutrophils go and clear the infection. So interleukin 8 also going to play by neutrophil chemotaxis. You guys also in the complement system what are C5? Good. The interleukin 12 induces differentiation of T cells into T helper cell 1 and activates natriculosis. The important interleukin 12 and it facilitates the granuloma formation in TB. And that all are secreted by macrophages, interleukin 1, 6, tumor necrosis factor alpha, interleukin 8, and interleukin 12. Now we are going to the interleukin that going to secrete by T cells, that is interleukin 2. Or we know it stimulates the T cell. It stimulates the growth of hyper cytotoxic and regulatory T cell natural killer cells. Interleukin 3 are going to support the growth and differentiation of bone marrow stems and function like CSF. They stimulate the proliferation of eosinophils, basophil, neutrophil, and monocytes. What is going to release by T helper cell 1? It is little bit of summary. If you guys remember the topic differentiation of T cell, already we learned These all the things that topic which thing is released from T cell macrophages and what is secreting from helper 1. It is interferon-γ that is secreted by natural killer cells and T cells in response to antigen and interleukin-12 from macrophages. When the interleukin-12 from the macrophages stimulate the T helper cell 1, they will release interferon-γ. And they will stimulate macrophages to kill phagocytosis to the pathogen, also initiate or support for the phagocytosis of pathogens, inhibits differentiation of T helper cell 2, and they induce the immunoglobulin G isocyte switching in B cell. Interferon-γ, the first thing they are going to switching of IgG. Secondly, interferon-γ is going from T helper cell 1, so they are going to inhibit helper cell 2. And secondly, they are going to macrophages, they will stimulate the phagocytosis of pathogens and increases the MSC expression antigen presentation by also it activates macrophages to induce granuloma formation. So guys, till now we are done with some granuloma formations. First, it is by interferon-γ, by interleukin-12, gamma, interferon, gamma, interleukin-12, and tumor necrotic factor alpha. From T helper cell 2, interleukin-4 are going to release that induces the differentiation of T cells into T helper cell 2, and they promote the growth of B cells, enhances the class switching to IgE and G. And they're too proud to beg for help. It's a mnemonic. It is too proud to beg. Beg means they are going to promote the growth in B cells, IgE and IgG switching, and 4 helping. Interleukin-4 is doing this function, that is raising 4 type 2 helper cell. Interleukin-5 promote the growth and differentiation of B cell and has the class switching 5Ga. They stimulate the growth and differentiation of eosinophils. I have 5B. 5B means B cell promotion for the growth, IgA formation, and E stand for eosinophil. If you guys correlate the mnemonic and memorize the thing or learn these things within the mnemonics, it will be very easy for you. Interleukin-10 attenuates inflammatory response. They attenuate or decrease expression of MSC class 2 and Th1 cytokines and inhibits the activated macrophage and dendritic cells are secreted by regulatory T cells. You guys already know regulatory T cells are going to regulate, maintain the immune response. So they are anti-inflammatory interleukin cytokines that are interleukin-10 and chemotherapy factor beta. They have a mnemonic that both attenuate the immune system, immune response, both before chemotherapy beta and attenuate 10. This stand for interleukin-10. Interleukin-13 is a promotes IgE production by B cells, induces alternative macrophage activation. They have an interleukin-13 doubly promotes IgE. That's an easy by the mnemonic only.